So in this case, you have a type 1A where you have a lesion with a sclerotic border, a type 1B where you have a well-defined border but a non-sclerotic border. Here you have sort of this heterogeneous border. These are non-aggressive lesions. Whereas if it's moth-eaten, you have areas where there are sublucencies all throughout the bone within the lesion. And then permeative is probably the hardest one to think about, but it's basically so subtle that you can barely perceive a lesion there. So there's only a little bit of bone destruction that it makes me even think whether or not the lesion is present. And these are aggressive. So this is an example of type 1. We have a geographic lesion with a sclerotic border, and it has a well-defined sclerotic border here. This is in a non-ossifying fibroma. This is a type 1B where you have a well-defined lesion, but there's a non-sclerotic border, and this is an example of a giant cell tumor of bone. Type 1C where you have basically a fairly well-defined, but the zone is a little bit more heterogeneous around the edges here. And this is also in a giant cell tumor. Moth-eaten, you can see these holes. They're all throughout the lesion, but there's no question that there's an abnormality or a tumor here within the lesion. This is a case of multiple myeloma. Permeative is harder to tell. In this case, wow, it's hard to even tell there's a lesion here. And that's the whole point. That's why it's permeative. It's very indistinct. But on the MRI, you can clearly see this abnormality here, even a soft tissue component that's coming out of the fibula in a patient with lymphoma. So those are the types of margins that you want to be aware of.